Chronic kidney disease can progress from early to severe over years without producing a single obvious symptom. But the kidneys are not entirely silent as they struggle. There are 6 specific signs that emerge as function declines, signs that most people attribute to other causes or dismiss as unimportant. Today I'm identifying all 6 with the full clinical explanation. I'm Dr. James Whitaker, board-certified urologist, and today's video is about one of the most important and most consistently underdiagnosed conditions affecting men over 50, chronic kidney disease. I want to begin with the number that defines the challenge. An estimated 15% of American adults, approximately 37 million people, have some degree of chronic kidney disease. The great majority of them have never been told. And the reason they've never been told is not because they slipped through the medical system. It's because chronic kidney disease has a biological characteristic that makes it intrinsically difficult to detect without specific blood testing. It is clinically silent for a very long time. Your kidneys are extraordinary organs. Each one contains approximately 1 million individual filtering units called nephrons. These nephrons filter your entire blood supply, approximately 180 liters of fluid daily, concentrating waste products into approximately 1 to 2 liters of urine. They regulate electrolyte balance with extraordinary precision, maintain acid-base homeostasis, control blood pressure through fluid and renin secretion, produce erythropoietin to regulate red blood cell production, and activate vitamin D. They do all of this while maintaining enormous functional reserve. Even if half of all nephrons are destroyed by hypertension, diabetes, autoimmune disease, or other causes, the remaining nephrons compensate with such efficiency that kidney function measured in the blood appears nearly normal. Symptoms of kidney failure don't typically emerge until kidney function falls below 15 to 20% of normal, by which point decades of progressive damage may have accumulated. This means that the window for effective prevention and intervention, when lifestyle modification and medical management can slow progression most dramatically, occurs during the silent phase that precedes symptoms. The only way to identify kidney disease during this window is through blood and urine testing. I will tell you exactly which tests to ask for at the end of this video, but first, I want to give you the 6 warning signs that the kidneys do produce as function declines. Signs that appear gradually and are frequently overlooked or attributed to other causes. Warning sign number 1: changes in urination. Specifically, changes in volume, color, character, or timing. The kidneys are, by definition, the organs that produce urine, so kidney dysfunction almost always eventually affects urination. The relevant changes include producing significantly more urine than usual, with urine that is very pale or clear despite normal fluid intake. This can indicate impaired concentrating ability, where the kidney can no longer selectively retain water. Producing significantly less urine than usual, reduced urine output, can indicate severe impaired filtration and in acute situations requires emergency evaluation immediately. Persistently foamy or bubbly urine that remains in the toilet bowl for more than 30 seconds is a particularly important sign. It indicates protein leaking into the urine through damaged filtration membranes. Proteinuria is one of the earliest and most sensitive markers of kidney damage and warrants immediate urine testing. Urine color changes, particularly dark brown or cola-colored urine without obvious dietary explanation, can indicate myoglobin from muscle breakdown entering the urine, a condition called rhabdomyolysis that can cause acute kidney injury. Any unexplained dark or unusual urine warrants same-day medical evaluation. Warning sign number 2: fluid retention, visible swelling around the eyes, in the hands, or in the ankles and feet. Healthy kidneys maintain fluid and sodium balance with precision. As kidney function declines, the kidneys progressively lose the ability to excrete excess sodium and water efficiently. Sodium retention drives water retention, and excess fluid accumulates in tissues throughout the body. As I described in the dedicated chronic fatigue video, the kidneys produce erythropoietin, the hormone that signals bone marrow to produce red blood cells. As kidney function declines, erythropoietin production falls. Red blood cell counts decrease, a condition called anemia of chronic kidney disease. Reduced red blood cells mean reduced oxygen carrying capacity and reduced oxygen delivery to all tissues throughout the body. The consequence is fatigue, weakness, and reduced exercise tolerance that is pervasive and persistent, affecting everything from morning energy to afternoon endurance to recovery from physical activity. This fatigue is typically described as qualitatively different from normal tiredness. It does not respond to rest in the normal way. It is present from morning to night, and it progressively worsens as kidney function declines. It is frequently attributed to aging, depression, or deconditioning, rather than recognized as a sign of a treatable hormonal deficit secondary to kidney disease. Please subscribe to this channel right now. I'm Dr. James Whitaker, and I post evidence-based medical content like this every single week. Hit subscribe, hit like, and drop a comment below. When was the last time your doctor checked your kidney function with a blood test? If you cannot remember, that is the most important thing to take from today's video. Comment your answer right now. Warning sign number 4, persistent itching, particularly generalized itching that is worse at night and does not respond to antihistamines or topical treatments. This sign surprises most people because itching seems completely disconnected from the kidneys. The mechanism is uremic pruritus, itching caused by uremic toxins. As kidney function declines, the metabolic waste products of protein metabolism, primarily urea and its derivatives, but also other organic solutes including beta-2 microglobulin, PTH, and various small molecular weight compounds, accumulate in the bloodstream rather than being efficiently excreted. When uremic toxins deposit in peripheral tissues, including the skin, they activate itch-mediating pathways through multiple mechanisms, including direct stimulation of cutaneous sensory nerve endings, activation of mast cells, and secondary hyperparathyroidism that affects skin calcium and phosphate deposition. The resulting itching is characteristically diffuse rather than localized, often worse on the back and legs, typically more severe at night, and frustratingly unresponsive to antihistamines or moisturizers because it is caused by internal biochemical disturbance rather than an external allergen or skin dryness. Men with this type of itching often suffer for months or years without the connection to kidney disease being made. If you have persistent, unexplained generalized itching, particularly at night, please ask your physician for a kidney function blood test. Warning sign number 5, nausea, persistent loss of appetite, metallic or ammonia-like taste in the mouth, or a distinctive odor on the breath. These gastrointestinal and oral manifestations occur in more advanced kidney dysfunction, when uremic toxin concentrations have risen to levels that directly affect the gastrointestinal tract and oral chemistry. Urea, one of the primary uremic toxins, is present in saliva and is converted by oral bacteria to ammonia, which produces the characteristic ammoniacal or metallic taste and breath odor. The same toxins affect the gastric lining and the gastrointestinal motility nerves, producing nausea, vomiting, and progressive anorexia. Men with advanced untreated kidney disease describe finding food repulsive, a level of appetite loss that is deeply abnormal and represents a serious symptom requiring urgent evaluation. These gastrointestinal symptoms are late-stage indicators of significant uremia and should be treated as medical urgencies. A man who has developed these symptoms requires immediate kidney function evaluation and nephrology consultation. Warning sign number 6, cognitive difficulty. The brain is extraordinarily sensitive to its biochemical environment, more so than virtually any other organ. Uremic toxins cross the blood-brain barrier and impair neuronal function in ways that produce a characteristic cognitive syndrome. Difficulty finding words, reduced processing speed, memory impairment, difficulty with complex tasks, emotional lability, and in severe acute kidney failure, frank encephalopathy with confusion and altered consciousness. In older men, who may have some degree of pre-existing cognitive vulnerability from vascular disease or early neurodegenerative changes, even moderate elevations of uremic toxins can produce dramatic cognitive deterioration that appears as sudden or progressive dementia. This is particularly important to recognize because the cognitive changes of uremia are often reversible with appropriate kidney disease treatment, unlike true neurodegenerative dementia, which is not. Any new or progressive cognitive change in an older man with risk factors for kidney disease, diabetes, hypertension, cardiovascular disease, should include kidney function assessment. Now let me tell you what to do with this information, because recognizing these signs and acting on them is the entire point of this video. The direct, definitive way to know the state of your kidney function is blood testing. The essential tests are serum creatinine, from which your estimated glomerular filtration rate, eGFR, is calculated. A urine albumin to creatinine ratio, UACR, detects protein in the urine before it becomes visible as foam, and is one of the earliest detectable markers of kidney damage. Annual testing of both eGFR and UACR is recommended for men with diabetes, hypertension, or a family history of kidney disease. If you have not had kidney function checked in the last year, ask your physician for a comprehensive metabolic panel at your next appointment. This is a basic, inexpensive blood test that is included in most routine health examinations and gives you the critical numbers. Early detection, finding kidney disease at stage 1 or 2 rather than stage 4 or 5, dramatically expands the treatment options available and the degree to which progression can be slowed. I'm Dr. James Whitaker. Your kidney health is worth protecting proactively. Subscribe for weekly medical content. I'll see you in the next video.